I did want to acknowledge the board that runs this Essex County Medical Society. And of course, first, some of our prominent people. Last year's recipient of the first Founders Award, Dr. Anthony Caggiano, past county and state president. Thanks, Sam. And Dr. Mark Olesnecki, certainly well known to all of us, past county and state medical society president. Steve, thanks for helping to put this together. Steve Fletcher, our current president. And Mike Brand, our president-elect. Mike, thanks, Mike. Mike Wozniak, our second VP, who will take over soon. And as always, our two stalwarts, Secretary Dr. Ray Joby and Treasurer Dr. Marv Wallen. I'd like to just say a couple of words. The order of the program is we have two wonderful lectures. We have a lecture first that Dr. Coyle is going to do, and Dr. Pecora is going to introduce her. And I want to say that that will be followed by a lecture by our very well-known state historian, Dr. George Hill, and I'll introduce George later, and you all know George. And but first, I want to say something specifically about the meaning of this award, of this day, Founders Day, and the reason why we make it so close to Thanksgiving. When I first did it last year, I wanted to have something working towards our bicentennial in 2016. And I wanted to get the people of Essex County and New Jersey involved with us. But it became much more than that. It pulled us together. We became a closer society. It helped us realize that hundreds and hundreds of doctors taking care of countless thousands of patients over hundreds of years right here in this society, and we stand on their shoulders and we benefit from their wisdom and knowledge. And I think that feeling was so pervasive that this day took on an even deeper meaning. And the second thing is that we went on the internet. We're forming a movie. Our executive producer and director, Pat Marucchi, is with us tonight. The movie's in its final editing, and that'll be coming out. And we have a website called historyofmedicinenj.com, which is the official now teaching extension of the History of Medicine of New Jersey, the Society's website. So this teaching and these talks, last year we had some wonderful talks, Dr. Hill, Dr. Fred Jacobs, Dr. Anthony Caggiano, and our talks tonight and our talks every year will go into this website as teaching for the students of New Jersey, as a place for historians, students, teachers, anybody interested in our culture of medicine, and this will build on it and be a continuing way of doing it. And I'd just like to mention that next year, Sandra Moss, who's on the level of Dr. Hill, not quite your level, George, but certainly a historian colleague of yours, has graciously agreed to lecture along with George next year. And we're hoping this wonderful table to my right that has so graciously come here tonight, who are the stalwart experts in Claremont Hospital history, Dr. Safina Pecora, chairing the Women in Medicine Society, and she graciously came. She's going to help me introduce Dr. Coyle, and I'm hoping next year I can twist her arm along with our wonderful administrators and nurses and women physicians to tell a very important story about how Claremont came to live up to one of the finest hospitals in the state. And I'm hoping that you guys, thank you for coming, because I want you to see what we're doing so you can do it for us next year, because I love you guys. So I really appreciate that. At this, let's see if I forgot anything. I think that at this time, Dr. Pecora, that was a good introduction for you.
Thank you, Dr. Prostowski. It is my privilege and honor to introduce my friend and colleague, Dr. Raluca Coyle. Dr. Coyle is a practicing nephrologist in Bloomfield, New Jersey. She is a well-respected physician who is board certified in internal medicine and nephrology. Dr. Coyle graduated from the Carol de Villa University of Medicine and Pharmacology in Bucharest, Romania. She completed her residency at the Brookdale University Hospital Medical Center and completed her fellowship at Albert Einstein College of Medicine, Yeshiva University. Dr. Coyle is on staff at many area hospitals, including Clara Moss Medical Center, St. Michael's Medical Center, East Orange General, and North Beth Israel. She is the director of the acute hemodialysis program at East Orange General and the director of the chronic hemodialysis center, the DaVita Center in Newark. Dr. Raluca is also the author of publications which include Biology of Renal Endothelial Cells and Endothelial Cell Apoptosis during glomerular capillary lumen formation in vivo. Dr. Coyle is a busy mother of 2 young boys, and she is a trustee of the Essex County Medical Society since 2009. It is my honor to introduce Dr. Coyle. Thank you.
Thank you, Sabina. I think I look better on paper than in real life, but makes me feel, gives me a boost. Also, thanks, Steve, the current president of the Medical Society, Essex County Medical Society, and Barry. You're going to wonder why women in medicine. I think the honoree for this night was supposed to be Dr. Anita Fala. I mean, actually, she still is. Unfortunately, she's not here tonight. However, I will give this talk on her honor. So, if you like the talk, please thank Anita. If you don't, just go to Barry and complain. He's the one that asked me to do that. So, I will start. Okay. So my talk it's called "Women in Medicine: What is the current demographic situation?" So. It's going to be a low-tech presentation. Unfortunately, I don't have a projector, but you have all the handouts. I started by looking at the national level to see how are women stacking up in medicine today in this day and age, and then, came down to the state of New Jersey and eventually focused on our county, Essex County. The information from, at national level comes from the U.S. Department of Health and Human Services, the Bureau of Health Professionals. And what we know from them is that in the past 3 decades, the percentage of women physicians have increased from 8% to 25%. And it's projected that in the next 2 decades, this number would double. So in the next 20 years, half of the physicians in the United States would be female. So this tremendous increase of number of female physicians in the workforce, it's going to dramatically impact and change the landscape in medicine. And like it or not, it's a fact. So, it's good to know about it and make the best out of it. So if you look at the national level, looking at the AMA data from 2006, I hope you can flip through the charts. But if you look, the distribution of males and females physicians in 2004 are showing that actually female physicians are younger than male physicians. And again, that's a direct consequence of the fact that there's an influx of female physicians coming into medicine compared to male physicians. So if you look at the age under 35, you would have 28% female physician and only 13% males. Also, the same difference in the age of 35 to 44 with 33% female physician and 23% male. Those numbers will flip as the physician test for ages, and of course, as we know, at older ages, the males are predominant. If you look at the employment status between male and female physicians, what you're going to see is the exact opposite. Females would tend to be more employees versus self-employed. You have about 60% of females run employee position and only 31% as their male counterparts are employee. On the other side, about 2/3 of physicians are self-employed and only 44% are self-employed. If we look at the productivity of male and female physician, what we found, and that's a reality, is that female physicians work less hours a week, on an average 49 hours a week, compared to male physicians would work 57 hours a week. And not only that, but they tend to work fewer weeks out of the year. At the same time, they tend to spend more time with the patient, on an average 2 minutes more per patient, which is about 10% of the average time spent by a physician with a patient. So taking into those two factors in consideration, you can say from a physician services standpoint of view, women are quote unquote less productive. That it's important because if you look at the physicians at the number of physicians that you need to train to supply all the physician services that are needed, you're going to have to train more physicians. The more female physicians you're training, the more in total numbers you will have to train to provide the same volume of services. The slide about the compensation just took me back a little. I hope it's outdated. It's from '98, and I hope that I'm going to look up actually at the more recent numbers as soon as I can. But what it shows that there is still a discrepancy between the compensations of male and female physicians. If you look at the unadjusted annual earnings, female physicians make on an average about $149,000 a year. Males about $208,000, and that's a 29% less unadjusted annual earnings. If you adjust for what I mentioned before, that they're working less hours and less weeks to the year, you can cut off on about 8%, so the discrepancy comes down to 21%, but that's still very significant. And also, then taking in consideration the fact that, let's say, there are less experience, the specialty level, the hours, and other practice characteristics, you can knock off another 3%, but the bottom line is it's still 18% less pay for women physicians for the same job. Now, there are more than one reason why that happens, and again, some of them I mentioned here. Women are more likely to practice in lower-paying medical specialties. They tend to have fewer years in practice because, as I mentioned, they're younger, they just started out in practice. They're less likely to be in a partnership position and more in an employee position. They work fewer hours per week in professional activities, and they're more likely to work part-time or take more time off. So this is the information at national level, and switching gears, going down, zooming in on the state. I looked first at the graduation rates in the state of New Jersey, looking primarily at UMDNJ, which is the biggest state school, I think, in the country, if I'm not wrong, or one of the biggest schools. On the slide, you can see two numbers. One, it's a combined graduation rate from 2006 for both the MD, which are medical doctors, and the School of Osteopathic Medicine, so the DOs. In 2006, there are 397 graduates, with 52.1% of them being female physicians. So it's already more than half, as of 2006, graduating from UMDNJ were female physicians. If you look in the enrollees, the first-year enrollees at New Jersey Medical School in 2006, there were 170 students, 44.1% were females. If you look at the Osteopathic School of Medicine, there were 107 and 68.9 were females. So the DOs are heavily female-oriented, I guess. Now, if you extrapolate those enrollees in 2006 to their graduating year 2010, we're going to say they're all excellent students. They all graduated. If you calculate their percentage, that comes up to 56.5% female. So the number is growing.
Washington is unique to medicine. I bet you'll find the same trend in other things. Law school.
Yeah. Well, I think that's the consequence of the 60s. What you see right now, it's just women going into workforce rather than just stay home. So, and I think we all have our thinking if this is good or bad. So, if you look now, so what I presented for New Jersey was the graduate. Now looking at the workforce, which are actually physician in practice, you can still see that in the state of New Jersey, it's still predominantly male. There are 73% male physicians and only 26.7 female. And that's pretty much consistent with the national average, which is 26.3 female physicians. If we look at the age distributions of female and male physicians, I compared New Jersey, the state of New Jersey, with the national numbers. And one thing that, there are two things to take out of this slide. Number one, that again, in general, female physicians tend to be younger, so because of the higher influx of women in medicine. That's both a trend which is true both at national level and in the state in New Jersey. But if you look, actually, there are less younger female physicians in the state compared to national numbers. So it seems that somehow the state of New Jersey, it's not very appealing for female physicians. If you look now at the, okay, now going more very specific for Essex County. One thing that we noticed comparing Essex County female physicians with the national average, what we can see is the women physicians in Essex County are older. You can look at this as a bad thing, or you can look at this as a good thing. When we're saying that the women physicians in New Jersey are older, you can always say, well, they were ahead of their times 20 years ago. So in other words, 20 years ago, you had more female physicians in the state than anywhere else in the country. And again, this is just to remind you that Dr. Fala is one of those trailblazers, and we should all thank her, or at least me and the younger of us that are here, that she just paved the way for us. Another striking thing for me when I look at those numbers, and again, those numbers specifically for Essex County are drawn from large databases from the medical staff offices at the local hospitals and from the database from Essex County Medical Society. If you look, compared to national standards, the female physician under the age of 35, very, very few in the state compared to, although there are more and more of them, very few are staying in this particular county, which actually houses one of the biggest medical schools. Why? I'm not sure, but I mean, I put a couple of questions mark for myself. It's a very competitive, heavily populated county with physicians. There are a lot of physicians in the county. The other thing I'm thinking, maybe some of them are going into subspecialties, so they will spend more time in training. They will not show up in the workforce. And probably some of them will step out or work part-time or not work at all, trying to establish a family. So I'm sure there are other thoughts, but those are the ones that came into my mind. Comparing male and female physicians in the county, the same trend, female physicians tend to be younger than male physicians. And again, another very significant thing that it just jumped at me when I look at those numbers, again, if you look at the age under 35, very few, and unfortunately both female and male physicians which are staying in the county. So I think this is very sad, and again, it's a troublesome trend to have so few young physicians that we retain. We train them here, and then they just go elsewhere. And hopefully that's going to be something that the school or the society is going to be involved more in and try to attract and retain more younger physicians.
So you need some older people
Well, I would say we need more older ones to train us better and retain us better. So, okay. Another busy slide, and probably the one that I work the most, but I like it the most too, is actually counting and looking through subspecialty distributions of female physicians. Again, it looks very busy, but there are three main areas. If you look at the bulk, which is the middle of the slide, with the exception of anesthesia, you're probably going to see that comparing the county with the rest of the country, we're pretty much comparable. It's the same proportion of female physician in those subspecialty. However, the thing to focus in, it's the bottom of the slide and the top of the slide. The bottom of the slide, it's the part which has most of, where females are predominantly in their specialties, or at least they have a very high presence. And those tend to be primary care specialty, lower paid specialty, like general pediatrics, psychiatry, pathology. Female presence is heavy in those subspecialty, but not only that, if you look and you compare the bars which are for the county compared to the national standards, actually it's even more so in this county. The opposite happens at the other end, which is the top of the chart, which the specialty, which have very, very few female physicians, and this skew, it's even more for the county than even for the national average, like orthopedic surgery, urology, or cardiology. These are surgical specialty, high-pay specialty. The women's have very little representation, and the county is even more shrunken than the rest of the country. So there's a lot of segregation at the both at national level and somehow even more in this county. And again, the questions,
right now,
yeah.
At the university, which is New Jersey Medical School, there are 24 residents. 21 are female. There you go. In my department, 21 out of 24. There are only 3 males left.
OBGYN, again, is very well represented, although it's a specialty, it's a surgical specialty. I suspect a lot of it has to do, which again has become less and less profitable, because of the malpractice,
In addition to residency programs, you don't think that in urology and orthopedic surgery there's a bias against females?
There are a couple of things. I would take the stand to say, number one, there's a choice. I mean, and that's just my opinion. As a female, I like to talk to kids or to crazy people or to pathology to that people. It's less likely that a female would like to play with robotic surgery or with orthopedic hardware. So that's one personal bias. However, there's, again, in society, it's still expected that the man is going to be the one that brings the bread home, so therefore those specialty will always gravitate and they will try to be retained by guys. So, yes.
My godchild graduated University of Florida, summa cum laude, and she is looking for a residency program. And from the day she was born, I knew she was going to be a physician. She is that kind of person, okay? And as she moved along, she went through all general practice, OBGYN, even emergency room medicine. And by the time she came to choosing her residency, it came to a choice of having a life or having a profession. And now she's vying for one of the top radiology and dermatology resident. Well, that's just it. It seems that the lifestyle of a woman who wants to have a family lends itself to something other than what my orthopedic professor told me was not a job, not an occupation, but a lifestyle.
I agree with you, and that's what I said. A lot of it has to, the trailblazer, the Anita Fallas, the Dr. Greco, all the ones they're ahead and they're some of them children of the 60s, where the women, all of a sudden, they wanted to go in there. Now what you see, although you see more women in medicine, you not necessarily see them as aggressive as they were at that point, meaning there's enough time for them to look that, okay, it comes with a price. Do I want to pay the price? So I think a lot of it is going to be individual decision. It's going to be family support, spousal support in the decision and what kind of specialty women are going to go into. So in conclusion, there are increasingly more and more women physicians in medicine. As it stands right now, they're more likely to be employed, paid less, and work less compared to men physicians. In the country, in New Jersey and in Essex County, there's younger physicians. I said they're more likely to be women. I think there's more and more likely for them to be women. For our local situation to look at is that there are fewer younger women physicians and physicians in general in Essex County compared to New Jersey and compared to the rest of the country. So I hope you enjoy it. I hope it's informational and helpful.
Thank you, Dr. Coyle. I think you can see, hopefully, this county medical society has enough wisdom to understand that we should be and I think Dr. Fletcher will bear me out on this, that we should be the welcoming place and the spring ground to help young physicians, male and female, stay here. And it should be, Steve, if you think that's right, that should be an important goal of ours.